going to move on to charity care. That's seen a decrease in the budget by $10 million. However, we're also projecting $10 million in revenue through the tax increase on insurance premiums that were passed last year. If it's not going to charity care for those most in need of health care, where is that money being spent?
Robin, I'm not familiar with where the 10 million. I can tell you the 10 million that was taken out was the add-on from the legislature of the prior year. So we went back to what we had in the prior fiscal year. I also can tell you that, and this is not to defend the 10 million in or out. Again, the hospitals will accept whatever the legislature feels is appropriate. But I think over $2 billion of COVID relief monies have gone to our hospitals over the last 2 years. I think it's about 2.2 billion, which is pretty significant number. And there's a number of hospitals that are participating in the county option program. And the county option program, I believe, will be bringing in about 17 million. The percentage of that goes to the hospitals will be moderated by how much goes to the county, which is a good thing. But there has been significant flow of dollars into our hospitals, definitely needed, and they certainly work for it and continue to work for it.
So would that be, so that request is adequate in your view? I am hearing from...
From my view, given all of the monies that have gone into hospitals, they need that and perhaps more.
So you don't defend the governor's request that exists right now in the budget for charity care?
I think that there are, again, almost $3 billion going into the hospitals over the past year and a half. It's pretty significant.
So will we get an understanding of where the revenue from the tax increase on the health insurance premiums will be spent?
Mm-hmm. Can you just clarify for me which tax increase, which revenue are you speaking about in the budget?
Last year's, in July of 2020, the premium increase went from 3% to 5%.
HMO
so
premiums assessment.
Yeah, so that revenue, where will that?
All right. So those dollars go into the healthcare subsidy fund, which is in your appendix of the budget, and those dollars are controlled by OMB, and they're used to support a number of different initiatives in the state, throughout the entire state. So that question probably would be better addressed to Treasury or to the Office of Management and Budget.
Okay, thank you. I just would assume that it was dedicated to healthcare expenses, and you'd be aware of how that was being spent. But I'll direct that to the Treasury then. Thank you.